She just couldn't walk even one step when she had come to the hospital. And the moment I treated her with an SI joint injection, she was completely all right. What I remember most is not the patients who are happy. I remember the patients who have not been very happy. Pain is actually very subjective. What is painful for me may not be painful for you. So, pain is actually a very unpleasant experience which a person experiences. In this era, mental health is the biggest problem. Nowadays, regenerative therapy is becoming a very, in thing. So, regenerative therapy is something where your body itself heals the pain or the injury naturally. Like if you have a scratch, you don't go to a doctor, right? It heals on its own.
Hello everyone. So you have seen a lot of videos on social media about the pain management, about the what are the causes of pain and how can we treat the pain. But do you know the person behind it? So today we are here with Dr. Kavita Katti from Katti Hospital. She is a pain physician and very well known doctor in Bagalkot, Karnataka. In this podcast, we'll know about the doctor. So hello doctor.
Hi, Mukul.
How are you doing?
I'm good. How are you?
I'm good. So I'll ask you some few basic questions.
Sure.
So starting with the first question, do you always wanted to become a doctor? What have you written in your scrapbook when you were a child?
So, I come from a doctor's family. I'm a third generation doctor. So, I think growing up, I didn't have much idea about any other profession. I always wanted to become a doctor. Yeah. So, in my scrapbook, I think at one point, I wanted to become an air hostess, which is like a joke now in my house. But then, yeah, I think when I grew up, I knew I wanted to become a doctor.
So where have you done your higher studies and your graduation?
Okay, so most of my childhood has been in Hubli. That's my hometown, where I have done my college and schooling and that stuff. I did my MBBS from Gulbarga, and then I did my post graduation in anesthesia from Belgaum. And then I trained in pain medicine. In most part in Bombay, and then a few trainings in Hyderabad and even abroad also.
Okay, so doctor, what qualification does a person need to become a pain physician? What are the steps to become a pain physician? Can you please simplify that?
Yeah, so basically, a pain physician, it is a specialty branch of anesthesia. So most of the pain physicians have completed their post graduation in anesthesia, and then they go on to get trained in pain. Pain is a very new branch of medicine. So growing up, we never heard about a pain physician, but now it's become, quite well known amongst people.
So, can you please break down your daily routine? I mean, what is the first thing you do in the morning, and what are the last thought when you go to sleep? How many patients do you consult in a day? What is your hospital routine? Can you please break it down for us? Because most of the people are asking about these questions.
The first thing I do in the morning is probably express gratitude, and it starts from there. And then, like everybody in my house is a gym freak, so I go to the gym. My day starts around 5 a.m. in the morning. After my gym, I come home, have my breakfast, and go to the hospital. On a daily basis, I don't know, it varies because most of the patients are referred to me by orthopedicians and neurosurgeons, chronic pain patients. So up until 3:30 in the afternoon, I'm either seeing patients, or I'm doing some procedure, or I'm doing admin work of my hospital. So once I'm back home, I like to spend time reading books or probably watch TV, though I don't watch much TV, but I like reading books. And my day ends by 10:30ish. I go to sleep. Again, it ends with a gratitude. That's how my day
Okay,
goes.
I think it's a good routine. I think everyone should follow this kind of routine because she's going to sleep at 10:30 and first thing in the morning she's a gym freak. So I think we should learn from it. So doctor, can you please share your any serious case study? I mean a serious case which ever comes to you, and after leaving from your OPD, the patient is happy because they have come out from their pain. Either it is a physical or emotional pain. Can you please share some?
So, see, as a doctor, the most happiest moment is when you see your patients pain free, when you conquer that pain for them. So many times we see patients getting well after getting treated, and but the most rewarding for me was one girl, a very young girl, who came with a severe pain in her back, which we call SI joint, actually inflammation. She just couldn't walk even one step when she had come to the hospital, and the moment I treated her with an SI joint injection, she was completely all right. And then she was like, so happy that she was walking on her own without any support, and she didn't have to depend on somebody else. So all that she expressed so much in front of me in the OPD that I felt so really very happy. So these instances keep coming, but what I remember most is not the patients who are happy. I remember the patients who have not been very happy, because at times patients really come to us at a very late stage, when we can't do much, when they have gone to pillar and post, taking all kinds of medicines and all kinds of stuff which is already messed up with their body. So those kind of patients really leave a bad memory for us, and I hope that patients really come to pain physicians, or any doctor for that matter, at an early stage, so that we can help them in a better way.
So, according to you, at what stage patients come to you? Like, for example, if he's having a headache, so and he's having a headache like once or twice a week, and he's facing some kind of a shoulder pain or a knee pain like once or twice a week, or he's facing the pain daily.
Mhm.
So, at what stage can they reach out to you?
So basically, see, pain can be acute or chronic. Like I always say, acute pain is something where your body is like healing from something, or saying that, okay, you've injured yourself, now I'm healing it. Like when you fall down or you twist an ankle, you know that it's going to go away in like 1 or 2 weeks. But then when the pain keeps coming and going, and it's there for most part of a month, and it is causing some problem in your day to day life, like if you're having a back pain which is not allowing you to sit for a long time on your work desk, or if there is a headache which is not allowing you to do your daily chores, so that is the point of time when they should consult their pain physician, and that is the time when we can help them.
Can you please simplify it a bit, like how a person or how do you define the pain?
Pain is actually very subjective. What is painful for me may not be painful for you. So, pain is actually a very unpleasant experience which a person experiences. And depending on the severity, a person can, take treatments for it, or visit a doctor, or do something about it on his own. Having said that, there's something which is called as, which is a new study which has been done, saying that emotional pain, which we are not addressing at all as doctors, also sometimes we tend to miss that emotional pain. So they say that your emotional pain can relate to your physical pain. Sometimes the emotional pain can become a cause of physical pain. For example, migraine is just a manifestation of your emotional pain, which is coming as headaches, or those things. So sometimes emotional pain is also as important as physical pain. So pain differs from person to person, but any unpleasant experience which lasts and which hinders with your day to day life, you have to consult a doctor for that.
So, if a person is having an emotional kind of pain, so the person does go to a psychiatrist, or he or she can comes to you?
Yeah, so mainly, like they say that in this era, mental health is the biggest problem. So I think if people who are going through emotional pain, or who feel that they have some kind of an emotional issue, should always consult a psychiatrist, of course. But if it is manifesting as a physical ailment, like a back pain or a neck pain, or something which is not bearable, then please do not take any remedies at home, or don't do something which is not advised by a doctor. Don't take over the counter medicines. These all things are going to mess up with your body, so best is to consult a doctor.
Sports person having a shoulder or a knee pain, so what your first go-to procedure to treat them?
Okay, so most of the times the sports injuries are because of the tendon injury, or muscle stretching, or some kind of a muscle breakage. These are the most common, like tendonitis, bursitis, and all these things. Fractures are not common in sports people, but they can happen. So there is no go-to treatment like for any ailment. But having said that, nowadays regenerative therapy is becoming a very in thing. Like, so regenerative therapy is something where your body itself heals the pain or the injury naturally. Like if you have a scratch, you don't go to a doctor, right? It heals on its own. Similarly, if there is an injury in a sports person, like a meniscal tear or a tendon tear, then what regenerative therapy does is we put the person's own blood, basically platelets or growth factors, which will release growth factors in that place, and then they help to heal that place, the tendon or the muscle. So that would be a go-to treatment in case there are tendon or meniscal injuries, not for fractures, of course.
So, what keeps you motivated?
So I think my biggest motivation is my patients. So every time I have a happy patient who comes back to me in the follow up and says, "I'm fine now without a surgery, and thanks to you that you did these minimal procedures, and I'm feeling really fine." So that is the biggest motivation. Sometimes, yeah, we have patients who are not very happy, but yeah, by and large, it is my patients who motivate me.
So, what do you suggest, more surgical or non surgical treatment for shoulder or back pain?
So there's nothing like this or that. It's always like, what is right in which person. Some persons, some people, the pain in the back or the shoulder can be treated by non surgical options. But at some point, non surgical treatment might not work. So then you will have to consider surgery. It's not like non surgical treatments are, can skip the surgery. That's not like that. Sometimes you have to weigh it. Some people might need surgery after all what we have done, and sometimes you don't have to undergo surgery. So there is nothing like this is right or this is not right.
Okay, thank you so much, doctor.